as I welcome in Tanya Blackman. She is the Executive Vice President and Chief Diversity, Inclusion, and Equity Officer at Novant Health. She joins us this morning. And Tanya, it's great to speak with you. I hope you're doing well today.
I am doing well. Thank you very much for having me on the show.
Tanya, let me ask you, because I literally, as I walked into the door, I had just got out of a meeting, as you did, with a nonprofit organization that I work with in our inner city known as the One Love Tennis Program, and they're working non-pandemic related with some 500 kids per week in talking about the importance and developing the skill sets needed to understand that great physical, mental health comes with being active, getting a strong, sound education, and then also adding the importance of a good nutrition, a well-balanced diet to that part of your life to have that great mental and physical state. And I think it was kind of a perfect storm here where I knew I was coming to speak with you fresh off our conversation with my friend Lenny Simpson over at the One Love Tennis Program and the things that they're doing. And that brings up a phrase and some terminology that we're hearing often these days surrounding health equity in our community. And given that I just came from our inner city area, I think this is a topic of discussion that you may have some knowledge in. So, let's talk about your role at Novant Health and some of the things that you're focused on day to day.
Yeah, thank you. Well, my role is really exciting at Novant Health. I've been with Novant Health for over 20 years, so I know the breadth and depth of what we do in our organization and in the communities that we serve. And my role is to make sure that we create a welcoming and inclusive environment and improve health for all of our communities, for our patients, our team members, and the communities at large.
I spoke with Dr. Jerome Williams as part of our first interview, and we talked about some of the disparities within the system and within the communities across our state and country, and right here in our region as well. When we talk about health equity, what does that mean, and why does that matter? Why should we as a community, care that every one of our citizens, have equity in the way in which we're able to consume and absorb our healthcare system?
Yeah, people ask me about that. Health equity sounds like a big word, and it really is for us for the attainment of the highest level of health for all people in all communities. Simply said, it's really improving your health, but we know that there are a lot of things tied to health. Financial health is important, or your financial status, whether or not you're understanding what's important in terms of what you should eat, exercise, mental health, physical health, all of that's important. So our goal is to make sure that we understand all of that and knock down or address barriers that would help you, that would keep you from being healthy in all of those categories. And when you do that, then you really can live your best life and attain the highest level of health for you as a person living in our community.
Now, we kind of know that, when there are situations in life that are often not, situations in life that are presented to us, by no fault of our own, and the chips may be stacked against you, again, by no decision or any type of situation that you actually, created, that in turn, there becomes long-term impacts of that, chronic diseases and health problems. And given the fact that we're in a pandemic right now, we know those most at risk are those who have to deal with some of these long-term healthcare issues and other things that pop up from time to time related to their both mental and physical health. Novant Health knows very well about these types of things. So what role does Novant play, in making sure that we're able to span the umbrella to make sure that, from side to side on the spectrum, that we're doing our best to create the most healthy community possible?
Right. Well, for us, Novant Health, healthcare is not just in the four walls for us. It really is outside of the four walls where people live. And part of our goal, part of our role is to provide the care where and when you need that. So one of the things that we do is that we look at our data. We look at our data, we connect with our communities and talk to the people in our communities and find out where are the pockets. So when we look at data, we look at race, ethnicity, age, gender, language, payer source or insurance, gender identity, sexual orientation. we want to make sure that we understand where the needs of our patients and our communities, where they are. We work with community organizations because our community organizations are already out there. You mentioned you were with a nonprofit. They're already out there doing great work. So what we do is partner with them and say, okay, you're doing great work. Let's look at how do we enhance what you're doing? How do we establish something where there's a gap in the community so that we can make sure we're achieving or pursuing health equity for all?
Tanya Blackman is with us. She's the Executive Vice President and Chief Diversity, Inclusion, and Equity Officer at Novant Health. It's part of our installment of interviews that we are conducting with Novant Health over the next number of weeks. So you, the listener and the consumer of this healthcare system at a future date potentially, will ultimately have a great understanding of their mission and the players in the game that are working diligently day to day to make sure we're providing the best health care possible, and that you as the individual could be positioned to potentially and hopefully you'll never have to work and be alongside many of the doctors and those who take care of us and work towards a better health and life for all of us. When we talk about Novant, Tanya, give us some specific examples of what you're doing and the collaborations and the partnerships that you're developing in the communities in which you serve already, as to how we can get to this place where many of us understand the importance of a health and wellness lifestyle that will extend our lives for a long, long time.
Yeah, I'd be happy to. Well, I think about investing in our people, which is really important. You can have an organization, you have a name, and you have buildings, but really what makes that work are the people inside of that building that makes the organization successful. So we take a lot of pride in investing in our people. One of the things that we have done in our organization is that we've invested in our team members who want to become nurses, who want to advance their career. So we have a scholarship program that's called the CNA to RN program, where if you are a certified nursing assistant and you want to be a nurse, we provide scholarships and a flexible schedule for you to be able to do that, because we want upward mobility for our CNAs and other team members as well. Supplier diversity is something we take pride into. We really like to bolster the economic development in a community. And as I mentioned, financial health is so important to our physical health and health equity. We work with women and minority-owned business enterprises in a community and look at what goods and services can we purchase from those communities. I'm really proud to say since 2006, when we launched this program, cumulatively since 2006, we have spent over $1 billion in purchasing goods and services from women and minority-owned businesses in the community. And that has really been helpful to us as an organization to provide high-quality goods and services, as well as helping the organizations, the businesses, to bolster their economic development. In terms of our community partnerships, we do a lot with communities, whether it's investing in affordable housing in the communities, making sure that we are providing education about health in our communities. We work with community centers and places of worship. We have parish nurses programs where there are nurses in the churches or places of worship. It may not be a church, a place of worship that can help that congregation to be healthy. So we really the sky is the limit in terms of partnering with communities. For COVID-19, we did we opened community assessment centers or respiratory assessment centers and screening centers in underserved communities, because we knew, as you talked about disparities, that in some areas, some zip codes, some populations, they didn't necessarily have access to health care as freely as others. So we opened screening centers to do that. We've also made sure that education is important and that we need to make sure we're providing education in the language that people understand. So we've translated a lot of our COVID-19 materials into at least 7 languages, the most spoken languages in the communities that we serve. We've distributed 400,000 masks in the communities to make sure, as we went into universal masking, that everyone has the opportunity to be safe and to have the proper equipment to make sure that they are safe and that they are well.
Tanya, with that said, your foot... go ahead. Excuse me. Go ahead.
No, you go ahead. I'm sorry.
Well, no problem. I mean, I see that the list is very long as to some of the things that you're doing on a daily basis, particularly when you mix in the fact that we've been in the midst of a health pandemic for the last 6 or 7 months. I'm sure the operations within Novant Health have been tested and are being reviewed, and I know that like many of us, everyone kind of looking in the mirror here and seeing what we can do better and how we can get there as quick as possible. With that said, I thought coming into the new year, 8 months ago, that this conversation surrounding the future of New Hanover Regional Medical Center was going to be the issue that we'd be talking about day after day, week after week. And while, of course, it's still been in the conversation, unfortunately, it has taken a bit of a backseat, at least the substance of the conversation, because everyone's minds have been consumed and the news has been consumed with the pandemic. So we haven't really got a great picture just yet as to really what the impacts will be when and if Novant Health, takes over our local hospital. So when we talk about, expanding the efforts surrounding health equity and getting into these communities that may be overlooked and underserved, how do you see Novant Health expanding those efforts to New Hanover County, when this potential deal moves forward?
Yeah. Well, the exciting thing is that you all have a healthcare system that has been doing great things in the community. So this partnership really helps us to expand the reach and the bandwidth to do that. One of the things that we want to be able to put into place is that the 300% poverty level and the charity care policy. In Novant Health, we actually provide charity care, that's what it's called federally, at the 300% income poverty level, which really means that if you are a family of 4 and your household income does not exceed $78,600 and you have no insurance, you will never receive a bill from Novant Health. We are committed to you having access to the highest quality care possible. And so when you go to the doctor, when you come to the hospital, if you fall in that category, then you will not receive a bill, and that is your insurance. I think currently right now in New Hanover, the poverty level is 200% to get charity care. It's at the 200% level, which means your income can't be more than $52,400. So our goal is to really expand that so we can expand the great care that's in that community and the enhanced care that will happen with our partnership. We also will have dedicated resources to look at the social determinants of health, looking at housing, looking at food insecurity, because that's so important to achieving health equity. So it's exciting to me that we're going to really be joining, hopefully, partnering and joining forces that we can expand the great work that's being done and enhance what's going to be done for the New Hanover community.
Tanya Blackman is the Executive Vice President and Chief Diversity, Inclusion, and Equity Officer at Novant Health, and it's great to have her on our program. I think very valuable information for you here today as we kind of get a better look as to what Novant Health will bring our community when county commissioners ultimately vote on this potential deal later on this year. Tanya, thanks so much for the time, and I look forward to future discussions.
Thank you very much. Have a great day.